Well, at the workshop we were talking about, in particular, issues related to orthopaedics and the pathways with the hip and knee pathways. Lots of patients require hip and knee operations these days, and it's vital that they get their operations in a timely manner, but also they're actually undertaken using best evidence, and that we produce no harm, using all the best prudent principles. And we discussed with patients in the room how we might attain those principles by co-production, by working closely with patients.
We've got professionals, we have patients, but we don't have a lot of opportunities to actually, meet and discuss our services. So we decided to concentrate on knees. We've got a huge service with a lot of subspecialties, but that's one of our sort of highest throughputs, and we're concentrating on total knee replacement, albeit everything that we do would transpose and could be used elsewhere.
One of the advantages of the day was that we were able to get together with some patients who were able to tell us what their experiences were of the pathway, and in particular some of the good and the bad things that they experienced in their journey through the pathway.
We think perhaps we know the best things and best outcomes for our patients. So some of the feedback we had were perhaps not things we would immediately think about wanting to change, or actually affected the people that we're caring for.
I was delighted with the attitude and reaction of the clinicians with patients. They were very understanding. They listened carefully to what we had to say. It was informal, and yet it was very informative.
I found it very, very interesting. I was on a table with 3 clinicians and a guy from the Prudent healthcare thing. And they were interested in what I had to say, and I was interested in what they had to say, to learn a bit about their views on patient care and where we were coming from. It was very much a two-way communication. Because I think that sometimes as patients we're in awe of clinicians. We don't ask the questions and the answers we want. So I think that they need to communicate better and explain the options.
We were communicating with the clinicians on the basis that we were the patient and we were giving our own experiences at the time that we spent in hospital.
We've talked about patient involvement and co-production a lot over the past year or so. I still don't think that we, as professionals, we know how to harness the power of the patient involvement in producing much better patient care, and patient involvement will be pivotal to a Prudent healthcare programme.